Hello and welcome to AMDA On-The-Hill, your periodic update for AMDA's public policy and advocacy activities. My name is Alex Bardakh and I'm the Director of Public Policy and Advocacy here at AMDA. Just as usual, I wanted to quickly update you on everything that's been going on in the world of policy over the last several months. Obviously, to start with is we are now entering yet another new phase of now what I guess we can term COVID recovery. And there have been some important updates, especially over the last week or so. First of all, I wanted to alert you to an interim final rule that was issued by CMS, mostly dealing with vaccinations and how we're going to vaccinate folks and how we're going to deal with getting back to quote unquote normal moving forward. First of all, I want to delineate what this means. There have been a lot of questions over the last year. There's been a lot of documents that have come from CMS and CDC, and a lot of folks have had questions about, how enforceable are some of these documents. For the most part over the last year, what we have seen are guidance coming from both CMS and CDC. Guidance does not, in effect, have a force of law. It is essentially what it is. It's guidance for all states and all facilities as to what they should be doing. It's certainly prudent to follow guidance, but you can't survey on that, and it doesn't carry the same enforcement mechanisms. In certain states and even certain facilities, in some instances, either disregarded the guidance or changed it significantly, or did what they wanted, and that created certainly a lot of confusion around the country as to how folks were dealing with COVID. What this is an interim final rule, and there have been several of these. And when they're issued, they carry a much greater enforcement mechanism. Surveys can be done on them, and this is something that all states and localities must follow. They can change it as long as it's not more stringent than what the federal policy says. So facilities will have to follow what the interim final rule does. Now, the reason it's called an interim final rule, of course, is because normal rulemaking would have a proposed rule followed by a comment period that would then result in a final rule. Because CMS has to operate on a much quicker basis, they issue what are known as interim final rules. I wanted to go into that level of detail a little bit only because we have gotten questions about what the difference is between these rules and some of these guidelines. The interim final rule does have a comment period. AMDA is going to comment on it, along with, I'm sure, many other stakeholders who will do so as well. But the final rule, it does go into effect in the dates that are specified in the rule. And so let's go into a little bit of what the rule actually talks about. And a lot of what it enforces is something that already been in guidance or had been in the works. It deals with reporting mechanisms. Most facilities have been reporting their vaccination rates to NHSN. It now creates a new F-tag, actually. So as you can see, again, enforcement mechanisms for reporting these. And there are some rules that I'm not going to go into here, but there are rules, and they're very specific about who to count in the vaccination rate and who to not count in the vaccination rate. It deals with who has worked in the facility the week prior. It details what that means, and there are some questions, I'm sure, about that moving forward. There are also questions that have come up in terms of the rule about vaccinating those that have not been vaccinated. And what we heard on a phone call that talked about the rule is that facilities will be asked to make, I guess, as much effort as possible to vaccinate everybody in the facility. Of course, vaccination is not required. We cannot ask specifically about why somebody's not vaccinated or force them to do so. But what we did hear from CMS is that you do have to make an effort to inform people about vaccinations and all of the data that's out there. And and what they told us is that surveyors will actually be asking staff and residents about efforts that have been undertaken to educate themselves about vaccinations. They will want to see literature, they'll want to do interviews and things like that. So this is something to keep in mind as facilities are trying to move forward. According to CMS, one of the questions that was asked is, let's say you offered the vaccine, one day and somebody said no, do you do that the next day? Probably not. So I think there's some leeway in terms of how you do so. But there's no question that CMS is looking at whether or not you're putting all the educational efforts into this and are trying, I guess, as hard as you can to vaccinate folks. AMDA is in its work group are looking at this rule obviously very closely. We will be issuing our guidelines to augment what CMS has done and continue to answer these lingering questions. No doubt, I think one of the difficulties here is we've heard from the federal government that something like a vaccine passport or whatever term you want to use is not something they're going to do. And so how do you continue to resume activities, resume visitation when you don't know the vaccination status? And in fact, according to CMS, one of the things that was stated was, if you don't know for certain the vaccination status, you kind of have to assume that they're not vaccinated, treat them as they're not. I think that, again, probably brings a whole host of questions and some challenges. But, as we enter the new phase, in particular with the recent announcement from CDC about masking, it brings into question how to safely reopen, how to talk to families about all of this. What about testing? Is that going to continue in case there are cases in facilities? So this is something that has been continued discussion. I think the states and localities will certainly make their own decisions as well. And if you have any questions, please feel free to reach out to us and let us know. Things with COVID, as they have been over the last year, change almost on a daily, if not hourly basis. And so I think it's important to keep yourself updated and certainly follow along with our website. A couple of other things that have come up or things we've been working on both on Capitol Hill and with CMS deals with telehealth. So obviously the public health emergency is still in place. It's actually officially in place until July. We've gotten indication from the administration that it should last the end of the year, but officially it's supposed to end in July. And given the pivot sort of from CDC that we've seen on things like masking, is it possible that it would be lifted before that or at the end of July? Sure, it is, but we have heard that it isn't likely. We don't know the chances that it won't. So, as the public health emergency continues, things like telehealth waivers are still in effect. So now there are virtually no restrictions on telehealth. Once the public health emergency ends, however, we do know that CMS, in its final rule last year, restricted the use of telehealth for nursing facilities, subsequent care codes to once every 14 days. And as soon as the public health emergency ends, that will be the rule. And, so this is something we are continuously working on. We're working on Capitol Hill and actually on a separate legislation that would create a separate payment system for a telehealth service, kind of a more in the value-based arena. And we want to continue to see the expansion of telehealth and the use of telehealth in these settings, and so that patients can be seen on time, they can be seen in person, and they can get the best care they can. And so that's one of those advocacy positions that we have taken. One of the other things I want to touch on really quickly is that our behavioral health work group, they have been looking at another area, of course, dealing with COVID, but on a slightly different angle. And that is, obviously over the last year, everybody working in nursing facilities has experienced trauma. It's unprecedented what had occurred. And, in some cases, they probably didn't know what tomorrow would look like or whether there would be an end to any of this anytime soon. And that's taken a mental toll on a lot of the staff. Obviously, we know that there's been a lot of staff have left. There's been great staff turnover. But we want to, our behavioral health work group is looking at, how to deal with some of these issues moving forward and how to work with staff and, with the nurses and the nursing home staff, but also, the physicians, the nurse practitioners, the medical directors that have been all a part of this. Obviously, it's taken a toll So they will be looking at this issue and issuing some guidance, some thoughts, some perspectives on how to deal with that. And hopefully that will be a useful tool. Overall, I would say that where we are right now is obviously as we enter more of the reflection stage, although it's by no means over, but a lot of folks are starting to look at where we've been and all of that. I think what we want to make sure is nursing homes have been in the spotlight, obviously, this year for the good, bad, and the ugly, as I've said before. And from an advocacy perspective, we want to make sure that the what we've gained in terms of our ability to be an influence at the table is something that is maintained. It is not simply a blimp, and in some people's cases, a negative blimp on the radar, but that we can come together and look at the lessons of the last year and really provide lasting and positive change for the patients and residents in these facilities. I think everybody's resolve over this last year who've worked in this space has shown tremendously about the type of people they work with. And so hopefully, all of you have been fantastic in helping us with our advocacy efforts. And hopefully we can garner that energy and continue to advocate on local, state, and federal levels for continued improvement for patients and residents in post-acute and long-term care facilities. Certainly we want to see lasting change for the better, and that we don't start dealing with things when they reach a crisis. And one of the things that we're hoping to do is to make an impact to where if there is a crisis, that it doesn't have such an impact as it did over this last year. So with that, I think those are the main topics I wanted to cover today. There are, of course, other things that are going on. I hope you're keeping in touch with or reading our policy newsletters that contain updates on payment issues and value-based medicine that hasn't gone anywhere. There's also, actually, I should mention, a proposed rule for skilled nursing facilities that updates the payment rates, establishes some changes in the quality reporting mechanism, including COVID, and things like staffing and other major issues that are still at the forefront. So as always, if you have any questions, please feel free to email me. Please stay engaged and stay in touch with us. And again, I want to thank all of you for your continued advocacy and your continued engagement on everything that we do.